Hi everybody, hello, I'm Jewel. Welcome to my channel. Today we're going to talk about what you should know about high blood pressure. And all of this information comes from the National Kidney Foundation. And according to the National Kidney Foundation, 1 out of 3 Americans have high blood pressure and may not know it. So let's see what it has to say. What is blood pressure? Blood pressure is the force of the blood pushing against the walls of the arteries. The pressure moves blood from the heart to the organs like the brain, kidneys, and stomach. How is blood pressure measured? Blood pressure is measured with a cuff around your upper arm. Cuff is pumped up and then down while listening to the pulse sound. Systolic pressure, which is the top number, is the pressure when the heart is beating. Diastolic pressure, bottom number, is the pressure when the heart is resting. Normal blood pressure is less than 120 over 80. People with blood pressure between 120 and 139 for the top number and between 80 and 89 for the bottom number may be more likely to develop high blood pressure unless they take steps to prevent it. What is high blood pressure? High blood pressure is also known as hypertension, which occurs when the blood against the artery walls is high enough to cause damage. In general, readings 140 over 90 is above are considered high. However, in people with diabetes or chronic kidney disease, a blood pressure of 130/80 or higher is considered high. One high reading may not mean you have high blood pressure. High blood pressure must be confirmed on follow-up visits to your doctor or clinic. How often should you have your blood pressure checked? It should be checked at least once a year, and anytime you see a doctor, as often as your doctor advises. What causes high blood pressure? In most cases, the cause of high blood pressure is not known. Some things may increase your risk of developing high blood pressure. Family history of blood pressure, race. African Americans have high blood pressure more often and more severely than whites. Age. There's a greater chance of high blood pressure as you get older. Being overweight, lack of exercise, excessive alcohol use, too much salt in your diet, oral contraceptives, gender, high blood pressure is more common in men than women, and of course, chronic kidney disease. What are the symptoms of high blood pressure? Usually you can't tell when you have high blood pressure. You may experience headaches or vision changes. High blood pressure is a serious problem. Yes, high blood pressure can damage important parts of your body, including your heart, brain, eyes, and kidneys. It leads to stroke, heart attacks, and kidney disease. How is high blood pressure treated? Treating high blood pressure usually includes a combination of medications and lifestyle changes such as losing excess weight, increasing exercise, cutting down salt intake, limiting alcohol use, changing your diet, and stop smoking. Will I need to follow a special diet? Maybe. Depending on your health status, your doctor may recommend that you lose weight, use less salt, eat less fat, flavor foods with spices and herbs instead of salt, eat food high in calcium, such as low-fat milk, yogurt, and high potassium, such as nuts, raisins, fresh fruits, and vegetables. If you have chronic kidney disease, check with your doctor before changing your intake of high potassium foods. What can I do to control my high blood pressure? You can have regular medical checkups, follow your doctor's advice concerning your treatment, take all your medicines as prescribed by your doctor, stop smoking if you are a smoker, avoid drinking more than 1 ounce of alcohol a day, get your family involved in your care plan. If you have more questions, of course, you can talk to your doctor or dietitian. And guys, this is what high blood pressure is, according to the National Kidney Foundation. And a lot of us, like myself, that are in kidney disease, that has kidney disease, usually has high blood pressure. And as the article just was talking about, they really don't know where high blood pressure comes from. But there are many ways that you can combat it with medicines, of course, exercise, weight loss, less alcohol, and everything that they recommended. So, guys, this is what high blood pressure is, and I hope that you found it useful. And if you like this video, please like, share, and subscribe, of course. And to my dialysis patients that was like me in the past, of course, we want you to know that we are thinking about you, sending you love, letting you know that this is that you're not traveling this road alone, that we have all had to travel this road to get to the other side of transplant. So now just keep yourself positive no matter what you're going on, and stay compliant always with your doctor's wishes. And I promise you, this too shall pass one day. So guys, take care of yourselves, and I'll see you in the next video. Bye.